Is this thing on?
I am Queens.
Hi, everyone. My name is Alyssa, and you are listening to the All Things Pelvic podcast, where you get to follow my life as a pelvic floor physical therapist. That may sound a little boring, but real quick, let me break it down. I bring up topics that most people find difficult to talk about, but maybe it's time we get comfortable with discussing the uncomfortable. I always strive for real talk, good vibes, and mostly all things pelvic. Join me and my guests as we discuss healthcare, culture, and real life topics. Are you ready? Because it's time to take a page out of my playbook. All right, guys, we are back, and it has been a week. A week, for sure. A whole week of craziness, but we are here, and this is our sex episode. And I'm really, really happy that one of my best friends is on here. Like I always say, pretty much all my best friends are going to be on here. Another special one from high school. Katie, do you want to introduce yourself?
Hey, I'm Katie. I'm Alyssa's best friend, and we've been friends for a long time, probably just as long as, or maybe a little bit less than Hannah. So like, what, 14 years, maybe 15. And yeah, I have no pelvic floor therapy experience, but I do love sex, and I am very knowledgeable on many different positions.
Yes.
You know what I mean?
Oh yeah, definitely. So, and I was honestly just thinking too, everybody listening to this is probably like, how many best friends does Alyssa have? Because this is like how I introduce everybody onto these
No
episodes.
one's allowed to tell you how many best friends you can or cannot have.
Damn straight, for sure. But like Katie said, she knows a lot about different sex positions and things. But of course, with like my line of work, I get asked about painful sex all the time, and that's unfortunately what a lot of my patients come in for, right? Now, what does that entail, and like who is it kind of involving? Now, it's all genders, honestly. In all genders, you can have some sort of painful sex, and that could be, let's say you have a woman, it could be with an object, it could be with a penis, it could be with whatever fingers the works, right? Whatever like you consider sex. Now, even for my guys, sometimes like erections are an issue too, and I help them out with that as well. So I had to do an episode on this because it's not talked about very often, and I think people get nervous about it too. I mean, knowing Katie, like I have no problem talking to you about this type of stuff. I also have no problem talking to anybody about these things, but that if we were to like bring up these things to certain people, of course it would be uncomfortable.
Yeah, definitely. I don't think I know many people that have ever talked about pain during sex. The topic is usually pleasure when you're talking about sex.
Totally. And then I also think that if somebody's having painful sex too, that then you have the friend that's like, oh my God, like I did this with somebody and I did this, and it's about pleasure. And then you're like, why have I not felt that before? Yeah. So it's like this.
But like, we're the people that are like, okay, tell me more.
Yeah.
Tell me every detail so I can recreate this.
Yes, exactly. You want to like recreate any positions or like do this and that. But like, real talk, totally TMI, but I definitely have had painful sex, and it's because like I do have pelvic pain. So like I do get where my patients are coming from when they come in and they're like, I don't really understand, like I thought that being tight was a good thing. And while it is,
honey.
Oh yeah, it is. It's definitely a good thing, but and this is me saying this, okay? This is me saying this. Sometimes I'm just like, yo, why though? Why? Like, why is this happening? Like, because I have now tried lube, and we have now tried some different positions, and like I still don't feel like the pleasure that I would like to feel. So with that being said, I definitely want to go over certain positions that I think are just beneficial for anybody with pelvic pain. Now, first though, Katie, top 3 positions for you.
3. Okay. Top three, doggy style, obviously number one. I think people agree with me on that one. Something about not having to look your partner in the face when you're making weird sex faces, like, really just gets me. So I love it from doggy styles. Number one. Number two, I would say being on top, regular cowgirl style or reverse. That to me, actually, I do have I don't know if it's pelvic pain because I'm not that familiar, but I do have painful sex in certain positions, and that one actually is like the one position that I don't ever really, and I like that's like the best for me. I love being on top. And number three, my favorite, which is not very sexy at all. It's like in the morning when you're just laying there, like in fetal position, snuggling, and they just go right in.
Yeah. Okay, wait.
Like, that's the best one.
Well, okay. This is going to be interesting because the first two that you said are not my favorite at all. So, okay.
Oh.
We're going to talk about this. So,
Okay,
yeah,
let's
totally love that third one you're talking about. Like, especially in the morning, like, that's a nice one because, like, then you're not, like, face to face and, like, you know, especially, like, just waking up, like, yeah. Not cute. I mean, like, I look like a gremlin in the morning, so that's how I feel about that.
Sometimes I look like a gremlin, and sometimes I look average. Never cute, though. Never cute.
Sometimes average. So, okay. Now, doggy style. This is actually a very known thing. Like, let's take typical doggy style. I'll go into my top three in a second, but typical doggy style, right, is like on all fours. Now, that actually places a lot of pressure onto the pelvic floor too. While I think it's like a very fun position, it places a lot of pressure there. So like something that you can do is like collapse doggy. So like arms kind of down but like ass up, you know, and like arched and, you know, a little bit more too, and like that actually puts your pelvic floor into like a little bit more of a relaxed position, oddly enough, like the more you arch your back.
So that's what I was gonna say. Even though it's my favorite and probably like the one that I always use, it is the one where I actually get the most pain because you have to be at the right angle. Like your back, you're right. Your back has to be arched completely the right way. I go flat chest to the bed or wherever I'm leaning against. Like it is not easy to get in the right position for that to feel good.
Totally.
And like that's actually, like you said, like that's where I feel the most pain, especially when it's like going upwards, like if that makes any sense. But I think everyone's kind of shaped differently, right? You would know that. So maybe the pain would be different depending on, you know, what's going on there. But doggy is definitely the most fun, but yeah, you can get fucked up.
Yes, no, actually, literally. So just so everybody knows, and I should have mentioned this before, but Katie and I do prefer to sleep with men. Just so everybody is well aware. But okay. Other TMI before I get into my top three. This guy once wanted me to not arch my back. So I felt like, okay, you know that chick that's from Family Guy and when she's like twerking but like her butt's not moving very much?
Bob's Burgers or whatever?
Oh, yes.
Yeah,
Bob's Burgers, yeah. Where she's twerking but her butt's like flat and not arched at all.
Not cute.
And then I did it with the guy like recently, and it's because I more so just like forgot about like arching my back, and he was like, "Liz, like." And I was
like, I can't keep up with all these different rules, like
right. And then I had to like explain to him why, and he was hysterical laughing, and I was like, "Yeah, my bad." I'm sorry. I was like, "Yeah, this guy did not like that," and he was like, "That's weird." And I was like, "Yeah, I know."
So if your man's telling you to arch your back, not a bad thing. Just do it. It'll probably feel better for you.
Yes, and it actually genuinely will feel better for you. However, if you do have like low back pain or something, that is where that position does get a little funky. It does. Right. Just because if you do arch your back too much and like that starts to hurt, I get it. So sometimes isn't the best position. Okay. My top three are actually completely different than yours, which is hilarious. My number one is missionary. And I am not vanilla in the bedroom, okay? Like, but missionary is my favorite because I just like when somebody takes control.
Yeah.
if I'm gonna be straight up, right? Like I just like that. It is also a lazy position for me. The more work you
Yes.
do, amazing.
Less work for me.
Totally. Love that. Absolutely love that. So
There's
that
no pleasure
really,
in work. No, I'm just kidding.
yeah, so oddly enough, that's one of my favorites. Yeah, there's that. My second favorite would be I do like that spooning position, like in the
Oh yeah.
morning. And so yeah, definitely one of my
Specifically
favorites.
in the morning though, I feel like is the best.
Definitely.
Because like, I mean, if you're with a man, men get so rock hard in the morning, like it's
Yeah.
impossible not to have sex.
Definitely.
But like you don't want to wake up all the way, so you're just like, oh, little slippity slide. Slide it in.
That's right. And then okay, this is again kind of missionary too, but like legs all the way up. Like all the way up.
Like
up,
spread.
up. Oh,
Like,
yeah.
are you holding your ankles, or is he holding them up like a baby? Like he's gonna wipe your
Ankles
butt
are
like a
like
baby.
on their shoulders. Like ankles are
Okay.
straight on their shoulders.
Yeah,
And then,
that's
like,
a good one.
Like hips up too.
Mhm.
Like hips up. So like that those are like my top.
Yes,
reason-
hips up. Always key. That's key right there.
Hips
Girls,
for sure.
put
Yeah.
Your legs up and your hips up. Do that bridge.
Oh yeah.
That hip
Actually
bridge.
though. Yeah, actually. And we're going to get into that in definitely like a little bit more detail too. But so being on top for me, this I cannot unpack in today's episode because that is like a long history of trauma, I think. Like a long history of trauma. But I have definitely had like body image issues. Katie, you know this about me, like losing weight at like certain points in my life and all this stuff. So being on top for me, actually, I get self-conscious with being on top. But once I start having sex with somebody more and more, then I'm fine, and then and then I get used to it, and I actually love the position. It's just for me with new people, which like I am single and stuff, so it tends to be more new people than not, but I definitely get like a little uncomfortable with that. However, being on top is one of the best ways to control your pelvic pain because you're controlling the amount of, and I do hate using this word, I hate saying penetration. However, it is the term to use, and it's like the medical term to use as well.
Penetration.
Just because you don't know if somebody's using an object or not. Like you don't know
Yeah.
if they are having sex with somebody who does have a penis too. It's like you don't know what somebody is doing. What if it's fingers as well? So it's like you kind of just have to say the word for what it is, and it's penetrative. It's something going inside something else. That just is what it is. So
entering you.
That's right. That's right. But that's one of the best positions too. So while I understand that it's a good position, it's not my favorite.
So that's funny because I know growing up and just in our experience, like all the girlfriends I've had, like a lot of girls feel that way about being on top. It's not just like, it's more common than you think. Like, and it's so strange because I feel like that's the moment, or like that's the time where you should feel so confident because like you're like sex is something so intimate, and like you have to be naked and you have to like love what you're looking at, and they have to like what they're looking at. You wouldn't be in that room if you didn't like what you were looking at.
Sure.
So it seems like when it's happening to you, it's like, like it's a very strong feeling, but then after it kind of seems silly. Like you probably wished, oh, I wish I just rode that dick like a crazy cowgirl and just took all my clothes off,
No, that's exactly right. That's exactly right. But what I will say though, okay, I might not like being on top, like with the guy lying down and then me kind of sitting on top. That's where I feel self-conscious. Even
so what
though,
if he's sitting?
No, I was just going to say that. I was just going to say that. That I like a lot better. Because that I
you
also
get more, like, I feel like you have more grip too, and like more like like I don't know, like it's easier to do it when you're both sitting.
Totally, more traction.
Yeah.
More traction. For sure.
More traction.
Oh yeah, definitely.
Getting some torque on this bad boy.
For sure. And then I also feel like that's like a little bit more intimate too.
Yes.
But
plus you can get the titty in the mouth that way.
Yep. That you can.
Harder to do if they're laying on their back.
I can't. That's right. So, okay. I definitely want to talk about my favorite sex positions for pelvic pain, right? Like, I totally want to
Mhm.
dive into that. So, we now know, like, kind of our favorite positions. And for two people that kind of do have pelvic pain and stuff, I feel like these are just good ones to try in general. I did a webinar on this recently, and I did feel bad because a lot of the people that were watching, didn't want to actually put their faces on there. Like it was a
Mhm.
Zoom webinar, and a lot of them were so sweet. They like would write in the chat like, "Thank you so much for talking about this, but like we just don't want to show our faces." And I was like, "I get it. You know, like I understand. I feel like sex is so intimate, and it's something that I feel like we watch on TV, and like yes, in some like comedy movies and stuff, it's like there might be something funny that happens
Mhm.
sexually and you like make fun of it or whatever it is, but for the most part, you're watching a show or a movie and it looks as if it's
And
always
there's probably 40 people in that room watching them as they do that scene. Like it's
yeah,
not it's yeah, it's definitely something people aren't comfortable talking about, but it needs to be more of an open conversation because people I'm sure are suffering and like maybe even getting on that Zoom without showing their face was hard, you
oh
know?
yeah, oh my
Let
gosh, for
alone having
sure.
if you had to show your face. So it's like making it a little bit easier for people to openly communicate about that, and that's great.
Always in the
I didn't even know I had pelvic pain. I thought pain during sex was just because whatever something's going on in there. I'm alive after it's done. Let's go and do it again.
I'm alive after. We good. We good. No,
I
but
went to the doctor. I'm clear. Let's go.
oh my gosh. No, but that honestly, you know, a lot of like our friends, my friends in general, like they've definitely messaged me saying like, hold up,
We could
what?
talk about this.
Yeah, and it's like, wait. Sex isn't supposed to be a little bit painful. What do you mean? Like what's going on? Like I'm not supposed to feel that like dull pressure when somebody's slamming on the back of you. Like
Yeah.
no, like you're not actually. You know, you're not at all. So it's like that stuff always where it makes me like cringe a little bit, you know, and it makes me sad too because then also a lot of people think that something's wrong with them, even though it's like, okay, yes, is there maybe your pelvic floor, you know, maybe something's not aligned in the way that it should be and all that, sure, but that doesn't mean you're broken, right? That doesn't mean that
Yes.
your body's just like this broken down thing. That's actually a very common thing to happen. Like we
Yeah.
sit down all day, we move around all day, we're always doing something with our pelvis that is going to have an effect on it. So how do
Yep.
we not think now that something like sex is going to have an effect on it?
Especially something like sex.
Yeah. I just got on a soapbox. I just got like very into that really quick.
That was good. I love it. I'm here for it.
Like actually
I'm
got on
here
a
for it.
soapbox, but
Because it's not something that that I've never even brought it up to you, but I feel pain almost every time I have sex because you can't always get the right position every time. And like I honestly, my biggest tip is, and I'll always stand by this because it's my favorite thing: clitoral stimulation, girls.
oh yeah.
Stimulate that clit, that pain will feel a little less. No.
Oh yeah. No.
But
So
really, like a lot of times, like that little bit of pain I get gets drowned out by pleasure, also. So it's not something that like I'm coming to you and complaining about. Like I just try to manage it with myself because it's not. I've been to the doctor. It's not something serious. They would have told me. Or maybe they don't know. Maybe I need to come to you and have you stick your hands inside me. But
no, actually though, you know, actually that's the thing. Like yeah, I feel like I need to treat you. We'll talk.
yeah,
That's
you
fine.
might need to.
Yeah.
Yeah.
We'll talk.
But like I don't have, it's not always painful, but I do sometimes have painful sex. More of the time it's like I said, it's drowned out by the pleasure of it all, by the whole thing.
Totally. And it's funny you brought up clitoral stimulation. I've been talking about this a lot more often lately too. That's actually how people orgasm more than penetration. Yeah. Which
100,
obviously
100.
yeah, 100. Totally 100. And that should be a known thing because it is your clitoris, right? So it's like that's the area that has a lot of nerves and you know it's what's going to help you have an orgasm. A lot of people think that they're broken because they can't have an orgasm from like I guess quote
Vaginal.
unquote regular sex. Yeah, like vaginal
Vaginal.
penetration. A lot of people feel
So
away by that, but that's actually, it is much more common to have an orgasm by doing whatever to the clitoris. And that's the thing too.
yeah.
It's like, I think one of my friends posted something. I need to send this to you. And this is a guy that posted it. This is a guy that posted it who I used to see, who I'm friends with now. And I was like in awe. It was like this whole thing about like what you should not, if you're dating a woman, what you should not complain about and the things that you should know. And it was like, know that she's going to have an orgasm with clitoral stimulation more than vaginal penetration. That was like one of the first things. Like, if she shaves for you, like, she's your goddess, because hair growing back is not the easiest thing. Like it hurts, all this stuff.
Absolutely not. It's itchy as hell.
The third, so itchy. The third thing was like, oh man, what did it? Something about birth control. Like, if she now takes birth control,
You take birth control.
yeah,
How about you take some birth control?
yeah,
It don't have to be the condom because I don't like that, but like take something then.
right. So it's all these things where I was just like, first of all, a guy posting that, dope. Love that.
Yeah.
Like, that's cool that like you're letting your people now know about that as well.
We need more people like that out there.
Definitely. But we just went on a whole tangent about clitorises. I'm going to get back to the sex position situation.
Yes.
Okay. Again, we have our favorites, right? And I'm going to kind of take those and like go through what you can do with them to make them a little bit better and stuff. And then that leads into a topic of different products that we can use, which I think is really, really cool too. So, okay, let's take now being on top. That is always like my first recommendation to people, just because, again, you can. And now this is me also, guys, talking about if I did have a female come in to see me for painful sex. I will say it's about 80% of anybody who has a vaginal canal that, comes into me for painful sex. My guys that come in, sure, I do have guys that have like erectile dysfunction, sometimes painful erections and all that too, but definitely more of my women, that come in with the issue of painful sex, especially if it's somebody like after they had a baby, whatever it is. Mm-hmm. So I would definitely say that being on top is one of the positions. For sure, that's one of the best, because you can control the amount of penetration that's happening in your canal. Cool. That's one of my favorites. Some people, though, can't spread their legs wide that open. So what I would even say with that is like placing some pillows underneath your legs, just like prop them up a little bit more. And then that helps to decrease the angle of like how much your hips are widened too.
So putting a pillow on each side of him
Totally.
or her and putting your knees on that.
Yeah.
Using that for leverage. Yeah,
so
like
simple.
that.
So simple. Now, I have a pregnancy pillow. So like it literally...
I know you do.
I think everybody knows that I have a pregnancy pillow. And it is U-shaped. So like I do already have two sides to it, which is like nice. Which is like
I'm never using that pregnancy pillow again.
I will say I have not used
Guys,
it.
don't touch Alyssa's pregnancy pillow.
I have not used it during sex. I
Okay.
promise. However, that thought just came into my head and like
you would
amazing.
tell us if you used it.
Totally. And I probably will at some point. Great. Great. So being on top is always my favorite. Then a lot of my patients do prefer missionary because, again, it was kind of my same reasoning, whereas like then their partner is doing more, right? Their partner is doing more, so they're not having to like move their hips as much because of that pain that they might be having. So with missionary though too, kind of same deal goes with like putting pillows underneath your legs as well. Like if they're not, if your like legs aren't above your head and stuff, if they're just kind of spread open, sometimes I have patients who like, if their legs are spread apart like that, they start to shake kind of, it's just like they start to shake and stuff. So even just propping something underneath both sides, again,
What about wrapping your legs around the person's waist Get it. I like that. And then again, you have the hip bridge to lift it up, to try to get maybe, well, this is missionary, right? Are we
Yeah,
still
yeah,
talking
yeah. No.
missionary?
But these are exactly the things
You
that
could
I'm
still
about
do
to
that.
say. Yeah,
Yeah.
exactly. So that actually is perfect. It's perfect because it wasn't even in my head initially. But if you wrap your legs around and then bring your hips up too, the more your knees are above your hips, the more your pelvic floor gets into more of a relaxed position. Just
Look at
based off of
that.
anatomy, just based off of like scientific stuff. Like
You're so
that's what
smart.
happens.
You're so smart. But yeah,
I more so see pelvises every day. Pelvises by day. That's me.
Elvis Presley.
Oh yeah.
That's your
Oh
name.
yeah. You've been wanting to say that for years.
I've been waiting to say it, and I didn't even say it with enough emphasis. But yes, this is Pelvis Presley.
Coming live, pelvises by day and pelvises by night.
By night. But yeah, I think wrapping your legs is good too.
For sure. So yeah, that kind of takes over missionary, I would say. I definitely use that pillow trick, and then bringing your legs up a little bit more helps to put your pelvis into a more relaxed position. Now, if you're going to do that hip bridge, though, stick that bad boy, those pillows, right underneath your hips and see what happens. And a question that I get asked, and this actually isn't very often, but a lot of people are just like, I don't know how I'm going to do that, like with being spontaneous. But listen, if you're with a partner that also understands what's going on, trust they will do what they have to do to, like, to do what they need to do. So yeah, that will happen.
Yes.
Yeah, being on top, missionary, and then okay, say if we prefer doggy style, like you do, top one for you, it is not ideal for pelvic pain. Also totally makes you queef up the wall. Like, oh, definitely queefing is.
Me and my partner, we sing "Oh McQueefer had a farm" every time after we have sex, just so that we can let them out factory style.
I cannot. I can't. You just. Yep. I have nothing to say. I have no words. I hardly have no words, and I don't have words for that. I now think of you and your partner slightly differently, and that's okay.
Yeah. It's not every time. I'm obviously exaggerating, but I'm just saying I agree with you. Yes.
Happy to know that you guys are. Happy to know that you guys are very comfortable in your relationship. That's great.
Yes,
great.
we are. Don't be self-conscious of your queefs.
Oh no. Because
queefs are normal.
It happens. It happens. Yeah, it's air pockets within the vaginal canal. It happens. It has nothing to do with your digestive system. I actually just posted about that today too. It has nothing to do with that. And it happens, and it's okay. It just laugh it off if you need to. It is what it is. Again, it's a normal thing. So doggy style, if you're on all fours and your back isn't arched, that places a lot of pressure onto your pelvic floor because you are now trying to stabilize your body onto 4 different points. There's really no point of your body that's relaxed now at this, in that. If you then arch your back, it does get a little bit more relaxed, but collapsed doggy style is a lot better. So as in the top half of your body down, butt up.
And butt then, all the way up. Yeah. Face down, ass up.
That's right. That's totally
why they
right.
say it, and that's why it is a thing.
Totally. That's why it's a thing in every single rap song. Face
but I don't think I honestly don't think I have much sex on all fours. I believe it's mostly, like you said, because it's not a good position to be in if you don't want to have pain. But also, what about bent over the bed? Bent over something.
Totally.
Not everyone can really arch their back. That's a thing. Not everyone can arch it in a position where it's not going to hurt. Yeah. And sometimes when it does hurt, it forces that arch back to collapse because of the pain.
Definitely.
So,
and then
maybe use some furniture.
No, but really though, try to figure out some ways that are a little bit more lazy for you, that you can maneuver your body into that. And so even over the bed is sometimes it's difficult because it depends on now how like tall your partner is too, right? Like how tall is your partner? How high is your
How
bed?
strong are your legs?
Yeah. What are we working with? What are we working
Yeah.
with here? But also with that, since your feet are planted on the floor, your pelvic floor now has to stabilize where your feet are. So they do now have to like work in that position similar to the all fours
Right.
position now. Yeah. So like the more like your feet are grounded on the floor, the more you kind of feel
So
that.
the upside of this is that the face down, ass up position is the hottest one anyway. Like that's the
Oh
one
yeah.
you want to be in. So let's just stick
Yeah.
with that, girls. Let's just stick with that.
Definitely.
And
Listen.
boys, stick with
Yeah,
that position
because a lot
too.
of people,
Face down, ass up.
that's right. A lot of people like that position and like that's okay. Like there's nothing wrong with that. So those are like kind of like my top three. Those are my top three. But then my fourth one that always comes in is the spooning position, like you said before, so that's a partner behind you. Same deal goes where like you should or just arch your back a little bit, more
Yeah.
too. And then of course them going like a little bit lower down and then kind of coming up a little bit more, if that makes sense. I don't know if everybody can like picture that,
Like
but
kind of like dipping.
yes, a little
Kind
bit
of
like
like
of
a
a
dip.
dip into a
Yes.
spoon. Yeah, yeah,
Yeah,
yeah, yeah.
I almost never feel pain in that position. Like that's one of the most
Yeah.
comfortable positions. Like, and it's good penetration too.
Totally,
Position.
totally. So those are like my top four. But if for some reason just even positioning is an issue, if positioning in general is an issue that you find, I I swear I talk about lube in like every single episode. I swear I do, but lube is like your friend, and
Yeah.
I understand where people are like, "Oh my god, I hate that I have to use lube." There's some people that they're like, "Oh, I'm all for it." Then there are some other people that are just like, "I wish like my body, like I wish I could kind of like lubricate a little bit easier." And I'm like, "Listen, there are no bad things about lube. Like there's nothing
No.
bad about it. Like it will help you feel better. Why not use it on both ends?
Yeah.
There are a lot of men who like lube too because they're just like, it made it a lot easier. It made it a lot easier to get into certain positions. It helps to relax your tissues
You
a little
can't.
bit
You're
more.
not. You can't stay even if you do lubricate. Like you can't stay lubricated the whole time, especially if you're having sex for a while. And
Oh
I can
yeah.
attest to that. Long sex sessions that last forever. You get dry. Like it's not. And I'm someone who doesn't have really that issue often, but like it happens.
Yeah.
I'm like I have to use lube once in a while. Actually, I haven't really bought it lately, but coconut oil has made its way into my bedroom.
Oh
And
yeah.
I don't actually know if you're supposed to put that in you, but like people put it in, yeah, people eat it. So I'm like, let me just
No,
put that
no.
inside.
I mentioned oils and things. Actually, I think it was in my very first episode. Yeah, I mentioned
Yeah.
oils and stuff. So if you just like if you place it like on your hand or like somewhere on, like somewhere on your skin and stuff too, and it's fine, it probably will be fine in your vaginal tissue
I haven't
too.
had any issues.
Yeah.
And listen, I highly recommend that. I know a lot of women have coconut oil because it's like the top beauty product.
Yep.
I'm pretty sure like everyone uses it, hair, skin, whatever, teeth
Yeah.
pulling. Use it in your vag, girl.
Did you just
I don't
say
know.
teeth
Don't listen
pulling?
to me because I'm not a doctor, but like, yeah, like they use it with their teeth too, like to clean your teeth. I'm pretty sure.
What?
But
Wait. I did not know
look it
that.
up. Look it
I
up.
had to just like double think for a second. I went, did she just say teeth pulling? Did she?
I'm
What?
almost positive that's what it's called, but again, I'm not a professional. But I will tell you that it's definitely helped out in the bedroom using the coconut oil, and if you like it in other holes, also a good thing to use.
Oh
Just putting that out there.
Listen, that is a real thing.
Yes.
Anal sex is a real.
Totally a real thing.
Yes, and people get pleasure from that, and like that's cool. You know what I mean? Like whatever you get pleasure from, do it up. Do you?
Yeah, it's your pleasure, no one else's.
Totally.
What's your pleasure?
Yeah. Well, lube is my favorite. But huge question from a lot of patients is about different products that they can use, and I always talk about these things. Dilators are great. So now dilators come in like various different sizes. Shout out to Intimate Rose. Intimate Rose is like one of my favorite companies. These dilators and her products are made. She is a pelvic floor PT, so that's where I think that there's like the beauty in that, is that she just knows, like she's worked with these patients before and she knows like what would benefit them and what would help them. So dilators are meant for people who do have painful sex, because unfortunately I do work with a lot of people who may have had like sexual trauma or something too. So like now they might be with a partner who they feel really, really comfortable with, and they can't kind of perform in the way that they want to. So dilators are a huge part of my treatment that I introduce to get their vaginal tissue and like their sensation back like a little bit more, and get used to that. So they're literally these little tubes, these little objects that now when people look at them, they're just like, oh my gosh, is that a vibrator? And it's like, listen, they look like them. Yes, like 1000% they do. And if you want to use dilator sexually, I tell my patients this all the time. I'm like, look, that's a form of foreplay, okay? It's like you're doing pelvic floor PT at home, but you're also getting yourself going. And that's okay. That's right. Yeah. Go for it. Go for it if you want to do that. So I usually have my patients like order them, bring them in, and then I'll teach you how to use them in order to like make more space in your vaginal canal. Yeah. And
well, that doesn't sound like something I would like to do on a 9 to 5, but I'm so happy that we have you to do that for us.
Yeah. And that's my patients. And this actually happens a lot this week, and it made me feel great, and it made me feel good about what I do. But one of my patients was just like, it really does take a certain person like to do what you do. And if I can help somebody have sex again, I will easily do that. Like I'm happy, and I'm happy to do that. So dilators are definitely my go-to, but always, 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 what I always suggest is see a pelvic floor PT first. There are plenty of people that end up ordering them, and it's not really shown how to use them and things online. So I just feel like you might be doing yourself a disservice by like ordering something like that and then not knowing how to use it.
Not having a discussion.
Yeah, I think it's always important to just like
always talk to a professional.
Oh yeah, just consult with somebody and that's okay, right? And then you go from there.
But just on the point of dilators, because I'm not really familiar, but I know like dilation is when it's expanding, right? Mm-hmm. So like it helps your canal to expand.
That's it. That's
just
exactly
so that's a little bit wider, less pain.
That's exactly it. So,
that's nice,
right? But
because you can also put a baby through there. But go on.
That's definitely actually what I teach my pregnant moms too, about how to, not necessarily using like a dilator, but like their fingers for like perineal massage and stuff too, so that they can like loosen up that tissue. You had a great point though by saying like widen, and I even just said loosen.
Yeah.
A lot of my patients get very nervous saying like, hold on. What's going to happen when it like loosens up? Yes, they get so nervous. And I'm like, no. We are getting your pelvic floor into the position that it needs to be in. Because right now, your pelvic floor is not. Those muscles are not aligned. Like they're tighter probably than what they need to be. Now, I kind of hate using the word tight sometimes because like somebody might not be tight. They might have muscle spasms. Like there might be some other things going on. However, if my patients are having painful sex, usually it is due to some form of tightness within the pelvic floor or muscle spasms. Now, we are not loosening up your vagina, right? We're not loosening that tissue
We're not
to
putting
make it
road like city miles on you.
No. Definitely not no city miles. Absolutely not. We're putting up like, I was gonna try to come up with like a little joke to that, and I can't think of anything. It's fine. It's fine.
We're putting highway miles.
There you go. Yeah. Something to go along with it. No, but if you can picture, say you have a closed fist, right? A closed fist. That's a tightened pelvic floor. We need you to have an open hand. Like that's what I want. Now, anything further than that open hand, kind of just like extending your fingers a little bit more, that is farther than what we need to be. But we need to get our hands to open, right? We always have to do that in order to do what we need to do. But my patients who come in, you guys are like in the closed fist position. That's what you're in usually. So we have to
Not for
loosen
long.
things up. Right. We have to loosen things up to get you to where you need to be. Next favorite product. You ready for this?
Yes.
It's called the O-Nut.
What is that?
Yo. But really though,
Is it a
the
donut?
No, well, actually, kinda. Okay, yeah. It's like a ring. No, okay, it's funny. I wasn't expecting that. Oh my god, maybe that's why.
Well, it's called O-Nut.
Katie, wow. I've always wondered why it's called the O-Nut, and I've been meaning to message the owner of it to like actually ask them why they did it, because like they're on Instagram. Like I've DM'd them a few times. They're great. And it's okay, let me explain what it is.
Yeah.
It is a ring-shaped device that gets placed over a penis or an object, and it controls the amount of penetration into the vaginal canal.
How?
I know. Sounds wild, right? The rings are different sizes.
Oh, so it's like a accordion of ring? Like it's like a slinky?
So, okay. Yes, but no. It's like parts of a slinky. It's like parts of
Okay.
it. Yeah. Wow.
So does his
I never thought
his
about it as
penis
a
or
slinky
the
either.
object end up looking like a ring toss? Like
yes,
that's what I'm
no,
picturing.
that's exactly what it is. It's literally like these rings and stuff, but they're different sizes. So, depending on how much of an object or a penis you want inside of you, so it's a good way to trial it out. So, you can start
Right.
off with like the biggest one at first to like only have a small amount kind
so
of
it
be
it
inserted.
stops at your wall at your body before, so you can't go any further, or the object can't go any further.
Exactly. That's exactly
Wow!
what it is.
Shout out to Onut
Right?
for
Such
making a
cool-
penis ring toss. I
Actually-
never thought. Who would have thought?
I know. So I learned about this from a patient though. She comes in and she was like, "Have you heard of the O-Nut?" And I'm also the type like I am not going to pretend like I know what you're talking about. To be like I will not do that ever. So
You'd be like the what?
yeah, that's exactly. I looked at her. I said, "The what now? What is an O-Nut?" And she was just like, "Oh my gosh, let me show you." So she brings in this brochure, and we actually looked it up together during our session. And she was like, "My boyfriend's all about it." Because my first question too was, "How does your partner feel about that? What does it feel like for them?" With
I mean,
with
they
them-
like right? They like something kind of being tight around their shaft,
So,
or So
he loved it.
yeah.
He loved it. He was like, and she even said though, and I thought this was very funny that she said this because they hadn't had sex in about, she was seeing me for like 2 months ish, and she was very nervous to have sex, which I completely understand. I completely get it. She has a very long background of like pelvic pain, and was nervous too, but she even said though, she was like, it had been a little while, so I think he was just grateful to like just have sex.
Yeah.
And it was just funny that she said that because I was like,
I'll put anything on it.
Right. right, and it was just,
Aw.
it was right. It was really funny that she said that because I was just like, that's actually very true. That's a very logical thing, like for you to
Yeah.
say. But I officially have it because this was a few years ago, and I've officially have talked to multiple patients about it, and each of their partners have been okay with it, have been
And they
more
like
than
it.
fine with it, and they like it. So that is another product that's out there that I think is amazing, where I'm like,
And talk about
wow.
keeping it spontaneous too, because that's something different. Why not put some rings on?
Totally.
Yeah, do it.
Totally. And so that's another product that I just love to promote because I'm like,
The
what-
O-Nut.
The O-Nut.
The D is sold separately.
That's right. The day is so separate. Oh, not really. Not really. That's really. It's probably because of a donut. I have to.
I
message,
wonder. You gotta
I have
ask
to
them.
message them. Yeah. And I'll.
I'm gonna
I'll
ask them if they want me to be their spokesperson, because I'll say the D is sold separately.
Okay, as much as I love you, I don't know if that's a good idea.
No,
or
they
not.
won't. No, it's fine. I don't need another job. I'm good.
Oh,
But that's awesome. I didn't even see, these are things that we don't even know exist out there, right? Like I think of a cock ring when you say, or a
Mhm.
penis ring. Sorry, that's really the unpolitical way to
That's
say it.
okay. No,
I think
but
of like
that's.
a penis ring when you say oh yeah, put some rings on it. Not
But
like
listen, but that's also how it's being said out there. Too
Yeah.
out there. As if I'm not
out there.
out there in this world. Yeah. That's what's being said though, and there's all these different things that are out there. And kind of the point of this episode too, like I know we talked about like sex positions, pain with sex, and all these things, but it's like my point always is that there's something that you can do about it. Like never think that. So I hope if anybody's listening to this and like whether you or your partner are kind of going through something in bed, like one, freaking communication is so important.
100,000%. You can't, how can you talk about this stuff if you can't communicate? Like you have to be comfortable and talk about this stuff.
Oh,
otherwise
God.
it'll be the same.
Definitely. And just know that there's like little tricks and little knickknacks that you can do. And don't be nervous about it. I say this to my patients all the time. I'm like, you're not going to know unless you try. That's another thing too. You're not going to know unless we try doing it and then we fix it. That's all you can do with anything.
And honestly, to the point of like everyone having, everyone's pelvic floor maybe having different issues, right? Like try your own positions. Look up the Karma Sutra, bro. Just do it. Like try it out. Me and my partner, just for fun, try different positions to see like what's gonna feel good or what our bodies are capable of bending into a position. But like make it fun. Like it doesn't have to be about this is a medical condition that's like wrong with me. It could be about, hey, like how can I make it comfortable and super fun for us and like we'll enjoy it,
Yeah, and you brought up a really good point. Do you want to make it known, we kind of just went over like 5 positions, like 4 to 5 positions, but do you?
Yeah.
Always.
Like feel it out.
These are just like my typical ones that I give out to people because they are known as like the more common ones. Like these are the ones that we see on these shows, right? These are the ones that we like see in the movies and do
or on
kind
porn
of do
that your man's or woman is watching.
Oh yeah.
It's all learned.
Yeah, but if you have a position that works for you, like awesome. And like don't be afraid to like experiment with that too.
What about a sex swing too? What if you're suspended in the air? I don't know.
Okay, honey. Now we getting into some other stuff. Maybe for possibly another episode. Maybe I
need to be on a different podcast for that conversation.
No. We can do mine, but full episode on that because I have a lot to say about those types of things. Like I have a lot to say about that. So now we know that you will probably be on that episode as well.
I'll make a cameo if need be.
Oh but gosh.
Yeah, well, those is very helpful information because a lot of stuff I didn't even know about.
Totally.
I'm excited to go have sex now.
That's right. And I hope you do later. Katie, it is always a pleasure. It is always a pleasure.
Always, always, always. I love you.
Love you. Thanks for being on here, hon. And I hope you guys learned something today. Again, if you have questions, you know where to find me, right? Peace out.
Bye.
Thank you guys so much for listening to the All Things Pelvic Pod. Have questions, concerns, comments? Want to share your story? Remember to follow me on Instagram at @the_pelvic floor playbook. DM me, share my stuff, like it, and let me know what you think. As a reminder, this is not medical advice by any means, so don't be out here doing a bunch of nonsense in these streets. If you need me and want a vibe, you know where to find me. I'm out.